Welcome to everybody in the room. Here in the European Parliament in Brussels, we've got MEPs, we've got clinicians, we've got academics, we've got patients, all sorts of stakeholders, and to you joining online. I think there was a little glitch there. Lovely to have you on board now. Great to be with you all here for this really important discussion, which is entitled 15 Years On, Reimagining the EU's 75% flu vaccination target in an era of COVID-19 and RSV. My name is Sue Saville. I'm an independent healthcare communications specialist, delighted to be guiding the discussions today. We're going to have a chance to take some of your questions later in this session, so please do speak clearly when you have that chance and say who you are. And please do promote what's going on today using the hashtag EU Flu Day. Well, to set the scene, I'm delighted to hand over to Michaela Nordenfeld, who is the head of coalition partnerships at ESWI, which stands for one of the many acronyms today, I think, the European Scientific Working Group on Influenza. Michaela, over to you. Thank you, Sue.
And good afternoon, everyone, and thank you for being here today. As you can see, I am not Colin Russell, co-chair of the steering group on influenza vaccination, who was supposed to be here today, but who unfortunately cannot make it. But it is my pleasure, on behalf of Colin and all the members of the steering group on influenza vaccination, to welcome you here today. In case you're not familiar with the steering group on influenza vaccination, it's a big name, long name. It is a multi-stakeholder group advocating for increased vaccination against respiratory viruses in Europe. And today we will hear about the value of vaccination against respiratory viruses like flu, COVID, and RSV, the tools we can use to ensure vaccination, to ensure the vaccination is used to its full potential, and the importance of immunization and helping to prevent complications associated with non-communicable diseases. And I'm looking forward to this conversation today, and I'm handing over to our moderator, Sue, and to set the scene on the current burden of respiratory viruses.
Thank you very much, Michaela. So, as you say, a very important discussion today. And when you think about some of the statistics, they really are quite shocking. The ECDC, the European Centre for Disease Control, estimates that up to 50 million people in the EU are infected with flu every year. That's about 1 in 5 Europeans affected in this way. And as of 2022, COVID-19 was responsible for 1.1 million deaths in the EU. RSV, respiratory syncytial virus, caused 160,000 hospitalizations among adults each year. And RSV is also the cause of 1 in 28 deaths globally among children who are younger than 6 months old. So these figures are huge, but they also have a huge impact on economies and on health systems. And of course, now we've got this triple-demic, as they're calling it, with flu, with RSV, with COVID-19. And yet there are vaccines there to prevent these deaths and to reduce the strain on our health systems. And it's a strain that most of you in the room will know we can't afford. So the burden of vaccine-preventable lower respiratory tract infections and these flu-like illnesses means the lack of clinical definition, though, is sometimes an issue in terms of determining exactly what it is. Vaccination is cost-effective. It can prevent infections, it saves lives, and it maintains economic activity in every flu season. There was a recent study that showed influenza vaccines, and it found that for older adults, vaccination is likely to more than halve the risk of experiencing flu. And 15 years after the adoption of the EU's recommendation of 75%, the steering group on influenza vaccination that Michaela referred to is calling then for this update on the 2009 Council recommendation so that it should include COVID and RSV. And one of the particular impacts we're going to think about today is the concern about non-communicable diseases, NCDs, chronic conditions, particularly things like cardiovascular disease, which of course is the biggest killer globally. these viruses have a huge impact on people who have conditions like CVD. Some studies have shown that a 33% reduction in cardiovascular disease is indicated when people are vaccinated against flu, and a 51% reduction in worsening of cardiovascular disease following flu vaccination has been found in some research. These are Collins' notes, and so I know he's got his facts and his data right. And there's also an impact on people with other conditions like diabetes. So what the important thing to get across today is that we can take action to prevent so many of these preventable conditions. And vaccination is a key part in that prevention. Some of the work's already underway through the Council conclusions on cardiovascular health, but this today is a unique opportunity to learn from our distinguished panelists. Welcome to you all, even those who tiptoed in just now. There's a new legislative term starting, and this is a great opportunity to put this important subject on the agenda. Now, of course, when there's a condition, who does it really impact? The longer term impacts on economies, but it's about people, it's about patients. And I hope you'll join me now in listening very attentively to the testimony of two people we're delighted to have with us today, Anaïs and David Cotting, who will speak in French. There will be an interpretation after a few sentences. Let's listen to their very powerful story of what can happen if you don't have a flu vaccination. Over to you.
Thank you. Mesdames et messieurs, merci de nous accueillir aujourd'hui. Je suis David Cotting et je suis venu ici avec ma femme, Anaïs, pour partager notre expérience qui souligne l'importance de la prévention contre la grippe. Notre témoignage est un combat pour la vie, une histoire de résilience et une prise de conscience. J'espère que ce témoignage vous inspirera.
Ladies and gentlemen, thank you for welcoming us here. My name is David Cotting, and I'm here with my wife, Anaïs, to share our experience, which underlines the importance of influenza prevention and the fight against it. This testimonial is a fight for life, a story of resilience, and a wake-up call. I hope our testimonial will inspire you.
En mars 2023, Anaïs et moi partageons notre vie depuis 13 ans. Nous avons une fille, Chloé, de 3 ans et demi. Le 6 mars 2023, Anaïs tombe malade. Le médecin diagnostique un état grippal sans gravité. Aucun signe alarmant jusqu'au 8 mars 20h. Alors que nous regardions la télé ensemble, vers 20h30, Anaïs, fatiguée, va se coucher. Elle reviendra m'alerter à 21h20 avec une difficulté respiratoire et un vomissement de sang.
Anaïs and me have been together for 13 years, and we have a daughter who is 3.5 years old. On the 6th of March 2023, she fell ill. The doctor diagnosed flu-like mild symptoms, no warning sign until the 8th of March, 2 days later at 8 p.m. when we were watching TV together. Around 8:30, she came to tell me that she was feeling bad, that she had a hard time breathing, and she was vomiting blood.
Je contacte immédiatement les services d'urgence et décris la situation. Il me demande de conduire mon épouse chez un médecin de garde. Lors de l'examen, le médecin prend la saturation et surpris par le résultat de 80%, la mesure minimale de son équipement, la norme étant entre 95 et 100%, une urgence vitale sous 92%, décide de recontacter le service d'urgence.
I immediately contacted the emergency services and I described the situation to them. They told me to go to the on-call doctor immediately. And during the examination, the doctor saw that her oxygen saturation was, he saw at 80%, but it was the minimum value for his machine. And the norm should be between 95 and 100%, 92 being a life-threatening situation. And we decided then to contact the emergency services again.
Les ambulanciers arrivent en 20 minutes et mesurent une saturation plus précise à 72%. À 23h12, elle est conduite à l'hôpital de Mulhouse, immédiatement en salle de déchocage. À minuit, 2 médecins viennent me chercher et me posent une série de questions médicales avant de m'annoncer que le pronostic vital est très engagé.
The paramedics arrived in 20 minutes and they measured her oxygen saturation at 72%. At 11:12 in the evening, she was driven to the hospital in Mulhouse in France, immediately to the crash room. And at midnight, the doctors came talking to me. They asked me questions and they told me that she was in a very critical condition.
J'ai pu passer 10 minutes aux côtés de ma femme. Elle était en détresse totale, paniquée. Son regard semblait me dire « Je t'aime ». Prends soin de notre fille Chloé. Elle ne pouvait plus parler. Elle s'étouffait et avait vraiment du mal à respirer. Ils décidèrent de procéder en urgence à une intubation.
I spent 10 minutes with my wife and she was in complete distress. She was panicking and her look was telling me, please, I love you, please take care of our daughter Chloe. She couldn't speak anymore, she was choking and she really had a hard time breathing and they decided to intubate her in emergency.
À 5h42 du matin, je peux la voir dans un box, endormie, sous respirateur. Le médecin m'annonce une dégénérescence globale des organes. Le cœur est à 138 battements par minute. Les poumons sont sévèrement touchés. Il n'y a plus de fonction pulmonaire convenable. Les reins ne fonctionnent plus du tout. On me demande de les prévenir en cas de symptômes similaires pour moi-même ou pour ma fille. On m'annonce de me préparer à un décès dans les 48 heures. À 9h45, on m'annonce également par téléphone la mise sous ECMO, une machine qui prend le relais des poumons.
At 5 a.m., I was able to see her in a box. She was asleep and she was on a ventilator. The doctor announced that her organs were degenerating. Her heart was beating at 138 beats per minute. Her lungs were severely touched. She had no longer an appropriate pulmonary function and her kidneys weren't functioning anymore. And they told me to call them if me or my daughter would have the same symptoms. And they told me to expect her passing away. At 9 a.m., they told me that they put her on an ECLS, so a machine that does the job of the lungs for her.
Après plusieurs prélèvements et analyses, le verdict tombe, la grippe A. Les plaquettes et les anticorps sont au plus bas et les médecins sont stupéfaits à la vitesse à laquelle la situation se dégrade. Ils pensent même qu'il y a peut-être autre chose, cela ne peut pas être une grippe.
After several examinations, the verdict is clear, type A influenza. The platelets, the antibodies are at their lowest, and the doctors are surprised at the speed at which everything is evolving. And they even think that there might be something else. It cannot only be influenza.
Après 2 jours en réanimation médicale, on m'annonce que c'est bien uniquement une grippe A qui a laissé place à une surinfection streptocoque pyogène, le corps voulant se défendre contre le virus et les bactéries à streptocoque, a déclenché un choc septique qui a créé les nécroses aux pieds et aux mains.
After 2 days in the ICU, I was told that it was only the type A influenza that then became a secondary streptococcus pyogenes infection, and the body wanted to defend itself against the virus and the bacteria, triggered a sepsis, and that led to necrosis in the feet and the hands.
Le combat pour la vie va devenir une véritable odyssée, une traversée des enfers. S'en suivront plusieurs tentatives de réveil, nécessité de sédation, diverses complications et opérations, notamment 2 pneumothorax, un épanchement pleural, une trachéotomie a dû être nécessaire, des escarres, une réaction allergique, Brest syndrome, une embolisation, une tension artérielle irrégulière allant de 6,4 à 22,11, une leucoencéphalopathie postérieure réversible.
The fight for life will become a true odyssey. She went through hell and back. Many wake-up attempts were undergone. She had to be sedated once again, and many complications and surgeries, 2 pneumothoraxes, 1 pleural empyema, a tracheotomy, pressure sores, an allergic reaction, DRESS syndrome, an embolization, blood pressure going from 6/4 to 22/11, and the reversible posterior leukoencephalopathy syndrome.
Anaïs va rester dans un état très critique et incertain pendant plus de 2 mois, sous respirateur, dont 53 jours sous dialyse, 41 jours sous ECMO. Pour moi, ce fut le choc et l'effroi à chaque information médicale. Je vais m'occuper de notre fille et informer de tout.
Anaïs remained in a critical state, uncertain state for more than 2 months. On a ventilator, 53 days were on continuous dialysis and 41 on the ECLS. For me, it was complete shock and fear at each information that I got. I had to take care of our daughter, comfort her, and also inform our family.
Je me réveille. Il y avait beaucoup de médicaments. Je n'ai aucun souvenir de mon côté. Jusqu'à mon réveil du 27 avril. Je me souviens avoir vécu un réveil très compliqué, dans l'inconscience de la réalité. Je ne me souviens absolument de rien. J'étais dans un état secondaire. Les médecins sont venus et m'ont fait plusieurs avis. Quant à ma situation, quant à mon état de santé, je me suis rendu compte que j'acceptais pas la situation. Pour moi, la situation était impossible. Et d'autant plus impossible que ce soit la grippe qui puisse conduire à de telles conséquences sur mon corps. Et je n'étais pas au bout de mon rêve.
I woke up on the 27th of April. I had received a lot of medicine, so I have no recollection of what happened until then. I woke up with a lot of difficulty. I didn't know what was true, what was not. I was in a daze. And then the doctors came and announced to me what the situation was. And I had a hard time accepting reality, despite having necrosis in my feet and in my hands. I could not accept the situation. For me, it was impossible to be in that state, impossible to have been in that state because of the influenza, and I was still not out of the woods yet.
Mon mari était présent à mes côtés. Il était présent quand je me suis réveillée. Cependant, je ne pouvais pas voir ma fille, qui avait 3 ans. Ça faisait 3 mois qu'elle ne m'a pas vue. Et ça faisait 3 mois que, forcément, après, j'étais en coma, je ne m'en souviens pas. Ça a été très, très dur pour une jeune maman comme moi de ne pas pouvoir voir sa fille. La douleur fut terrible. C'était une douleur qui était physique, mais aussi psychologique.
My husband was there when I woke up. However, it was impossible for me to see our daughter. I realized that it had been 3 months since I hadn't seen her, and it was very difficult for me to accept that for a young mother like me. And the pain after I woke up was physical, but just as much psychological, since I had many announcements of amputations to come.
Quand ça allait un petit peu mieux, quand mon état était un peu plus stable, nous avons pris la décision de faire des opérations d'amputation. Au niveau... Il y a beaucoup de choses, je suis désolée. Au pied à droite, la jambe droite, on a dû couper les orteils, nettoyer le talon. À gauche, on a dû couper les orteils, le premier métal, nettoyer les talons et couper les premières phalanges des mains. Pendant 1 mois, j'ai eu des soins suite à ces amputations. Mais j'avais beaucoup de douleurs. Je ne supportais plus la morphine. Ça me rendait encore plus malade. Je n'avais plus les douleurs des amputations, mais j'en avais d'autres. Et je crois que c'était encore pire. Tellement j'ai souffert. Dû à cause de la morphine.
Once I felt a bit better, we decided to amputate. I had my first operation where my where my toes were amputated and my heel was cleaned. And then on the left side, I was amputated up to the metatarsal. My heel was cleaned as well, and also my phalanxes were amputated. Of course, the care during 1 month were terrible. I had terrible pains, and my body could not stand morphine anymore, which made the situation even worse.
Pendant 1 mois, j'ai continué les soins. Au bout d'1 mois, un chirurgien est venu me voir et m'a dit qu'au niveau de ma jambe gauche, donc là on avait coupé les orteils et les métals, la jambe était trop abîmée. La cheville était figée, je ne pourrais jamais marcher avec cette jambe. Il m'a dit, Madame Cotine, on coupe, vous marchez, on ne coupe pas, vous marchez. Alors, j'ai pas le choix.
I was cared for 1 month, and my left foot wasn't healing. So a doctor came and told me, Ms. Cotin, we need to proceed to an amputation. Otherwise, you won't be able to walk. If we proceed to the amputation, you will walk. If not, then you will not. So I decided to do it.
Ensuite, pendant 6 mois, j'ai continué les soins et la rééducation, donc amputation transtibiale à gauche et la première amputation à droite. Sauf qu'à droite, ça ne cicatrisait pas. Toujours des douleurs, la cheville également figée. Pendant 6 mois, j'ai essayé, mais je pense qu'au bout d'un moment, on arrête d'avoir d'espoir. Du coup, le 5 août de cette année, j'ai pris la même décision qu'à gauche. J'ai coupé à droite, au même niveau. Voilà.
For 6 months, I left my legs to heal, my foot to heal, and I tried to rehabilitate. However, they told me there was no hope for it to heal. So therefore, 6 months later, on the 5th of August this year, I decided to amputate up to the same level as on my other foot in order to be able to walk.
Je suis appareillée donc aux 2 jambes. Ça va. Mais je continue la rééducation. De temps en temps, j'ai des douleurs. Je ne marche pas comme avant. Je ne marcherai plus comme avant, mais je fais en sorte que ça aille. La grippe, la simple grippe m'a pris beaucoup, énormément. On doit s'adapter. Hein. Le fait de ne plus avoir ses jambes, même si c'est des fausses, c'est quand même pas des vraies. Donc on doit faire avec, mais sans. Donc je suis handicapée, à plus de 80% physiquement, mais j'ai aussi un handicap pulmonaire, parce que mes poumons ont été beaucoup touchés à cause du sport. Du coup, je n'ai que 50% de mes capacités pulmonaires. J'étais aide-soignante, donc j'étais d'un côté de la barrière, et j'étais patiente, j'étais de côté de la barrière aussi. Donc je ne pourrais plus faire le métier des soins. C'est fini, je ne peux plus prendre soin des autres, il faut d'abord que je prenne soin d'eux. Mon mari a aussi perdu son travail. Pendant 6 mois, il s'est occupé de moi à l'hôpital. Il s'est occupé de notre fille à la maison qui avait besoin qui n'avait plus sa mère mais qui avait son père, donc il a dû faire papa et maman. Il a été le temps qu'il a arrêté, son employeur l'a licencié, l'a remercié. Nous sommes ici aujourd'hui pour partager notre témoignage, autant à mon mari qu'à moi, parce qu'on est dans le même bateau. Hein. Il a souffert. Il souffre encore, mais moi, quand je dormais, je n'ai pas souffert, je souffre maintenant. Hein. On dit toujours que la grippe, c'est vrai, c'est pas grand-chose. Mais c'est une grosse erreur. Hein. Il n'y a pas de petite grippe. La grippe n'est pas une maladie anodine, c'est pas un petit virus qui passe par-ci, par-là. Il existe une prévention, le vaccin, et ce n'est pas que pour les personnes âgées ou les personnes fragilisées, c'est pour tout le monde. En tout cas, je vous remercie à tous pour votre attention et merci d'avoir écouté mon témoignage, notre témoignage à tous les deux. Merci beaucoup.
I now have a prosthesis on both sides. I followed rehabilitation. I still have to do it. I still have pain, and I won't be able to live my life like before. The flu and the influenza took so much from us. It's true. We need to adapt to a new situation. I cannot live like before. I am disabled to more than 80% physically, but also pulmonary. My lungs only function at 50% because they were very touched by the virus. I was a nurse before, a profession that I can no longer pursue. I was caring for others, and now I have to take care of myself and be cared for by others. My husband also lost his job after 6 months of taking care of me. He was fired. And if we are sharing this with you, our testimonial, it's in order for you to understand and to share the information. Because very often influenza is thought of as something that is a small cold, but it's much more than that. It can be much more serious than that. It's not an innocuous illness. And there is prevention, and prevention is the vaccine. And it's not only for the elderly or for fragile people. We thank you very much for attention.
Alors, merci beaucoup. Annie's est un vie très touchant, très puissant, very powerful, very, very touching. How very brave to come today. Merci beaucoup, beaucoup. My gosh, what testimony we've got there from these people who've been so affected. We're so grateful, so grateful. Thank you so much.
Very difficult, but necessary.
Exactly. And your message that flu is not a trivial illness, and that the vaccination is not just for older people or some other people, it's for everyone, as you said so powerfully, Anaïs. Thank you so, so much for that contribution. Gosh, we are hosted here at the European Parliament by MEP Dr. Andras Kulia. Thank you for hosting us here. Now, I understand that Dr. Kulia is not only a medical doctor, but something of an influencer on something called TikTok. I don't know what that is. And he spreads his message out there. So thank you so much for hosting us. Over to you. How can the platforms you work on help to spread the message that Anaïs and David have so powerfully put, that vaccination is so important?
Thank you. It's an honor to be here, and I'm very sorry that very late I took part in a panel discussion at European Patient Forum, because I think it's very important to have a connection with patients and talk to patients, with patients, and listen to them, because it is how we can keep their trust. And I think that trust is key, because when we're talking about vaccines, and I just want to mention one first shocking moment here in European Parliament during the first MV committee meeting, that one MEP said, and I don't want to mention the name, that instead of sending medicines and vaccines to Africa to help them, instead of this, we should have to strengthen the natural immunity, and it was just shocking, because and I also said that at the committee meeting that 200 years ago the average lifespan in Europe was 37 years, now more than 80. Only 100 years ago the infant mortality rate was 16.5%, which means that 165 out 1,000 child died before their first birthday. That's what natural immunity means, and we all witnessed the growing skepticism about the vaccine during the COVID pandemic, and misinformation is just spreading so quickly through social media, and it was an empty or undiscovered place, I think, to help professionals. And I started my educational channels or platforms when I switched from psychiatry to surgery, and I realized that in surgery, surgeons, Mr. Andrukaitis knows this very well, that there's sometimes no enough time to talk to the patient. During the night, when you have 4 or 5 urgent surgeries, there is physically no time to talk and explain everything. And I thought that it's not okay with my background, that it's not okay. And I tried to find solutions to explain the medical conditions, the surgeries, what will happen to the patient on YouTube. And actually, when I created my first video, I learned how to record, edit video about the camera, soapboxes, everything, and wrote the text. And I thought the text would be the easiest part. And I recorded the video. My wife, she was sitting in front of me, and she said that it's not okay. It's not good. And I asked her why, and she said that I cannot understand this. And I said, why? Because you use words that I don't know what these words means. And at that point I realized that our language is absolutely different from common language, because we use words, medical words, in everyday discussions with our colleagues, but we cannot expect to know this patient because they have no medical background, and we must explain the evidence-based facts on an understandable way, and also talking about vaccination, there is an emotional part because people just see this misinformation and also some facts that maybe 1 out of 10,000 patients could have some side effects. And they think that it's a bigger chance than not taking the vaccine. Because many of us, I think it's a human behavior, things that we can control that will be infected or not. But actually it's out of control sometimes. And we see these outbreaks of polio in modern world, in Western countries, in different parts of the world, because people just cannot, they do not remember, because they cannot remember how life was 200 years ago. Until some point, the vaccinated people could keep safe the unvaccinated. But after some level of decrease in vaccination, the infection just can spread through the population. And then the stakes are absolutely different, because it's not anymore 1 out of 10,000, but it could be 1 of 10. And we heard how serious effects and consequences we have even in influenza, and we think that it's not so serious, but yes, it could be, because as we have different color of hair or different color of eyes, we have a different type of immune system, and we don't know that to what type of infections are we very vulnerable, and what infections could have a very huge and serious impact on our immune system or our neurological nervous system or other parts of our body. And we medical professionals, of course, we know that, but I think it's our responsibility to translate this knowledge to the common language, to explain people how actually vaccine work, how the immune system works, because without this knowledge, they could make decisions that in the long term could have not only a very devastating effect on their health, but on health of our communities. And it has a social part and also an economical part, because people could develop some long-term side effects, and they could can lose their jobs, and from economic perspective, they are not anymore taxpayer, and they cannot contribute to GDP. But the states should care about them. So I think it's still better solution to pay attention and to make educational programs more important, because in the long term it's much more effective. And I'm trying to do this in my social media, explaining in a very short video an evidence-based facts, but translated to a common language some topics, also HPV or influenza, because it's very important. And we also witness the crisis, it's 2 more sentences, and we cannot expect to, when we just preemptively start talking about vaccines and immune system, we cannot expect people to believe us because they don't know us. So we must build up this trust, to listen to them, as it is how I started my TikTok channel, that I read the comments, and I was reading comments for Organized just to see what are the needs, what my viewers want to know about more and to get information. Because after answering to their questions, after that I can explain topics which are important to me or to healthcare professionals. So it's very important to pay attention on that part of prevention, what means education, the educational part of prevention, because through this we can we can help to make better decisions, and at the time of crisis we have the trust and we can help to make people to make a good decision to avoid serious side effects or even to save life. Sorry, I was
No.
maybe too long.
Thank you very much indeed, Dr. Andra Twilia, MEP from Hungary. Are you able to stay with us to take some questions later in the session? Because that would be superb. Thank you so much for your testimony. And as you say, so much misinformation out there, and fantastic to know there are people like you combating that misinformation with your two hats. You're a new MEP and a long-standing doctor. Thank you very much indeed for your contribution there. Well, at this event, we have two panels, and the first one is going to consider how data and digitalisation might help increase the uptake of the flu vaccine. Because, of course, since the recommendation came in 2009, technology's advanced a little bit. So how can it help? What can it do? Well, the 75% uptake rate that is the target has only been met by two countries, Ireland and Denmark. They stand out as shining stars. The rest of Europe has a lot of catching up to do. What needs to be done? How can digitalisation help? I'm delighted to introduce the first speaker on this panel, who is Dr. George Cassianos, who is the National Immunisation Lead at the Royal College of GPs, that's the family doctors in the UK, and also a board member at ESWI. So, Dr. Cassianos, over to you.
Thank you very much. Well, digitalization is essential if we're going to achieve high vaccination rates. I think we need to accept that. Electronic cards go some way towards that, but the goal really is full digitalization of the vaccinators, which is really primary care. Once primary care is on one IT system for all its work, we can then see the benefits of digitalization. We know who has not had the vaccine from our patients. We can actually send them messages, text messages. Hardly anybody doesn't have actually a mobile phone today. We can call specific patients for specific reasons. For example, pregnant women for their pregnancy vaccinations, the older adults, we call those in the groups at risk. And we can audit our performance. So this is actually very, very important because digitalization allows us to there and then audit what we are doing and take steps to call and recall our patients. Also, we have ethnic groups in our practices, and we find that vaccination of ethnic groups is much lower than the indigenous population. Again, we search on ethnicity and we can actually identify them and we can actually call them in. If we have an IT system in primary care in the EU, the government will have up-to-date vaccination rates. The ECDC will have figures that they can actually publish, that they are meaningful. And of course, the EU then has accurate figures. Now, the benefits of digitalization of primary care, where the vaccinators are, do not stop here. Patients can make an appointment online at the time that is convenient for them, because the number one reason the patients give for not attending vaccination is that the time of the appointment was not convenient. They can receive back information from us electronically, and they can receive also reminders about their vaccination. So digitalization provides us with greater ease and confidence to call in patients and vaccinate. There is greater transparency in the system generally. information is readily accessible, and data is readily available. Now, I'm very, very lucky to have lived with a national IT system of the NHS in the UK now for many years. And when I sit with the vaccine administrator, we put in what we want. For example, we want the 65 and over who has not had their vaccine. She presses the button and all the names are there. Then we write a message. We are at Birchill Medical Center vaccinating now. We have reserved the vaccine for you. Please come. We press the button and hundreds of messages go out to everybody who has not been vaccinated. This is digitalisation. We need it in every EU country. Only then we can really achieve the vaccination rate for the older adults of 75% that the European Council has actually put forward, extended if possible to the groups at risk, but also it is the same target of the WHO to achieve over 75% vaccination rate. Now, countries that achieve that, according to my information, is Portugal, is Denmark, and the UK. And these countries have done it for at least 3 years in a row. The UK has done it for 4 years. So it is very important that we do it because it's doable. Thank you.
Thank you very much. Bravo. So good to hear the NHS get a bit of a shout out. You mentioned Denmark as well as another shining example, and we have with us Dr. Tyra Grove Krause, who is the Executive Vice President of Epidemiological Infectious Diseases Preparedness and very important job title at the Statens Serum Institute in Denmark. So from a national perspective, you're a great example of how things are going well. How have you made digitization work for you?
Well, I think it all started in 2009, where I started to work at the Public Health Institute, and it was my first task to work on the development of the Danish vaccination register. So that's when it started. And this register was launched in 2012, together with the legislation that it became mandatory to report all given vaccines in the register. All healthcare providers, they have to register their vaccines, even those vaccines given in the program, the national programs, but also travel vaccines. Citizens, they have access to their own record. Parents have access to the records of their children, and healthcare workers have access to the records of their patients. And this has helped us to prevent over-vaccination. You know, we have all tried to lose our physical vaccination cards, and sometimes you will get vaccines that are not needed because you don't know the vaccination status. But most importantly, it has helped us to increase the coverage to our vaccination programs. And that is because we have this overview, and also we have also used it to send out reminders before due date to all children in the Danish vaccination childhood vaccination program. And if they're not vaccinated at the due date, they'll receive a recall reminder 1 month after the due date. And during COVID-19, we also started to send out invitations for COVID-19 vaccination and influenza vaccination. And as mentioned, we have achieved the coverage of 77% in the elderly populations. It has also helped us to study determinants on missing vaccination. And during COVID, we could identify areas where there were low uptake, and we actually sent out mobile teams, vaccination teams, and the health care workers that would knock the doors to inform about this opportunity of getting the vaccine. And if there was consent from the citizens, they could actually go and get vaccinated in the local clinic. So it has also been extremely important to increase the public trust in vaccination, because we are able to use the data to explore any safety signal that may occur. If we see any hear rumors about side effects, we can study it quickly and also respond to it if it's a true signal. And we can also document the effects of the vaccines on burden of disease. Also during COVID-19, when a new variant occurred, we could explore how the effectiveness of the vaccines against these variants. So I think they're really, the electronic vaccination systems, they're really crucial if we want to maintain trust in vaccines, and they can also help us to increase the coverage, because it's so important that we can provide the right data at the right time.
Thank you very much indeed. Thank you. And before we hear from the European Commission, I just want to say we have another MEP with us, Andrea Kaitis, and I think you have to rush off to another meeting. So do you have a contribution that you'd like to reflect on at this point?
First of all, my contribution is related to my question. How many people now are in the room who are vaccinating yourself against influenza? Please raise your hands. Okay, you see, not 100. It is invisible because it's just in 25 member states of now we are UK. We can exclude that at the moment. You see that the rate of uptake of vaccine against flu is very low one, and of course COVID also is going down. We all know that we just 1 hour before we just discussed issues about COVID transitional initiative. COVID and flu are going hand in hand. We need to understand it now. It's very important. But being very short, first of all, thank you very much for your brilliant intervention. That intervention is so important to show it to all countries around EU. Because we did it when we organized Vaccine Summit, or Global Vaccine Summit, when I was commissioner. We also used some very really inspiring examples. It can encourage all of us to understand the situation and move forward. And my final message is, it would be good to think about electronic vaccination card to all Europeans, especially the children. Why? We have now 180 million people who are working in different member states. They are going with their families. And sometimes they can vaccinate their children, but in some countries, vaccine calendars are different. They are telling it's too early, in another it's too late, and they are in the gap. We need now to seek to get into keeping in mind IT tools and to develop, for example, child vaccination, IT child vaccination card, or a vaccination card for elderly people, and use such vaccination card around all EU. As you know, you have in your pockets simple reason. We have such ID card. It's pan-European. It needs to have the same IT card related vaccination. It would be much easier to collect data and collect situation. Thank you very much. Andreas, you are doing a brilliant job. Congratulations.
Thank you very much. Thank you for your contribution. So hello and welcome to MEP Gabriela Gerseni, who's with us. Thank you very much for joining us. European Commission's perspective on this, you've heard about some suggestions there. Wolfgang Philipp, who is the Chief Scientific Officer at HERA, the EU's European Health Emergency Preparedness and Response Unit. How are you going to prepare and how are you going to respond?
That's a good question. First of all, I have a couple of minutes time, right? So it's always difficult to speak after ex-commissioner Andrea Kaitis. That's really the worst slots, but I try to do my best. But let me become a bit more serious. I think it was a brilliant idea to have a testimonial by Anais and her story, because otherwise we're sitting in a lot of panels. We're discussing things that can be changed, that should be changed. There's a lot of approaches. At the end of the day, you need to have somebody who's doing things. So therefore, bringing us back to the ground and seeing one single case of complications after influenza A infection, that is much more. It says much more than a report again with 100 pages describing so many cases happen here and there. Because that is something you keep in mind also when you try to dissect ways on how to react to design ways to improve systems. So let me come to a couple of points. I'm working for HERA. That's not really, we are not really taking care of routine vaccination. Our interest is more in pandemic influenza, when it comes to influenza. But nevertheless, I would say everything that was said here, basically about digital tools, about electronic vaccination registries, that is all feasible and it should be there. That is relatively simple. It would have to track, improve vaccination coverage for all kind of respiratory viruses, and we have seen this during the COVID pandemic. There's a couple of lessons that tell us it is possible to establish rapid data sharing systems, also in countries where you usually communicate by fax machines. That was the story we had. And Denmark is always a good example to show how you can integrate, let's say, clinical data, public health data, and also unstructured data into something that makes sense at the end of the day. It is cost effective and it's resource sensitive to trigger your responses. That's not just in emergency cases, but that can also be done, obviously, in the area of routine vaccination schemes. As you mentioned it, Dr. Castellanos, and you said digitalization is essential. I saw your notes before, so I would say, and that is coming also from the roundtable before, information is essential. Because, many people, at least my old mother, she would not know how to, and she can use the phone to pass a phone call, but not to deal with the information she would receive. So we need to think about smart ways of information. But to trigger the information, obviously we need to have the right data, and data can be manifold. We have seen in the COVID pandemic that things like telemedicine and digital healthcare services are possible. So why are these things slowing down nowadays? Because that would certainly help also not just giving advice to people that might have a need for information about vaccine efficacy, safety, security, and availability, but also about triggering decision making of individuals. Commissioner, I always still call him Commissioner Andriukaitis, mentioned digital health passports or digital vaccination cards. We all have, I don't know how many of these things in our pockets. So what is the problem in establishing these things? Obviously, there is a risk, and there's always sensitivity around data protection, about security, fully understood. But I think nowadays that can be solved. And then, just coming from a meeting in Berlin, the World Health Summit, and there was an interesting gathering of specialists in artificial intelligence and use of applications based on AI in the healthcare sector, and it's a field at full expansion. So at the end of the day, I think we will see, perhaps even before that report here is written, useful applications based on AI that will change the scenery when it comes to identify, structure, also unstructured information around vaccination, about vaccine uptake, and also proposing possibilities on how to speed up these things.
Thank you. Thank you very much for that contribution.
Thank you.
Among you three of the panel, you touched there, Wolfgang, on the AI. How could that help perhaps address some of the gaps that there are in the vaccination programs? Is that a tool that you see that would be useful?
I think relatively in the vaccination programs, a program is good if a program lives. If you have the means to implement a program. So I think one point that is relatively common is the lack of information about vaccines. Where do I get it? What do I need to pay? Is it safe? Does my neighbor take it? Okay, that's not part of that. But at the end of the day, people want to know what is the benefit of getting vaccinated. And systems based on these large language models help already in medical applications. So why not developing particular applications into that directions that supports GPs and nurses, which are overworked in their job to provide information which needs to be based on trust. That also sounds a little bit like a broken record, but it's very true. So having something which is a bit more independent than, I don't know, an organization or a company saying you need to get vaccinated, having good systems that help people to understand in a short and crispy way what is the benefit and where to get access to vaccination, that would certainly help. So these systems are on their way, 100%.
And in Denmark, then, Tara, you have these very efficient systems. But what about digital exclusion? Not everybody, including Wolfgang's mother or mine, can manage, and some people can't afford a mobile.
No, but
So for those who are digitally excluded, how do you reach them?
by physical letters. So in Denmark, everybody who communicate, when you communicate with the authorities, you have a special electronic mailbox. And if you cannot administer that, then you get the information from authorities by normal mail. So we send out physical letters to those who don't have an electronic mailbox.
Okay. And George, you were saying in the UK that there's a very up-to-date live system of knowing who's vaccinated. What could the rest of Europe learn from the UK on this occasion?
I think we really need to computerize fully primary care where the vaccinators are for all their work. We need to really look towards that rather than just vaccination. But there are things that we haven't even agreed in the EU. For example, the definition of the older adult differs according to which country you are. Some countries are over 65, some countries are over 60, one is over 59, and another two are 55 and over. So we need to agree on that. The next thing we haven't done is that since the influenza season 2020-21, the ECDC has not published vaccination rates of member states for influenza. We need that data. Now, if my country is right on the bottom, I'm trying harder to actually raise the vaccination rate. If my country has high vaccination rate, I need to stay there and go be even above that. So we need information from the ECDC.
Thank you. I thought old age was always 10 years older than one is now. I thought that was the measure. Or 20.
20.
Certainly a long way off. But thank you. Well, let's now come to our second panel to consider the impact of some of these respiratory viruses on those who have more chronic conditions, non-communicable diseases like cardiovascular disease. How are people there impacted? Are they at greater risk of actually getting, say, flu, and indeed the complications that can ensue that we've heard so dramatically about? So we need to make sure that there's vaccine confidence in order for these people to get those vaccinations. I'm delighted to turn now to Griet Hendricks, who is a senior project coordinator within Vaxinfectio at the Centre for Evaluation of Vaccination at the University of Antwerp and the Vaccine Confidence Project, a member of the steering group. Griet, over to you.
Good afternoon, everybody. I want not to spoil this party on the vaccine, the flu vaccine itself and the vaccine confidence, more in particular, because I want to present a little bit data on the vaccine confidence project we have run in 2018, 2020 and 2022, and also there is data lacking for the coming years 2023 and 2024. But we investigated the vaccine confidence in general in the 27 European countries, and we compared them in the different years. And I will more focus on the flu vaccine. So what we are asking people in each country is if they think that the vaccine is important, is safe, is effective, and is compatible with their beliefs. That's the main questions that we are asking. And what was already foreseen is that for flu vaccine, it's rather the confidence is lower than for children vaccines. It's a little bit higher than for COVID vaccines, but I can mention that only one on 5 of the people don't think that it's important for them. So it means that only 4 on 5 people think flu vaccine is important for them. For safety, it's even worse. So there is an issue on vaccine confidence. Luckily for flu, it's something very strange that we see. It's that the COVID didn't have really an impact. So the decline that we see for children vaccines, we don't see on flu, but we don't know what the reason is. Maybe it's because of the attention that there was for COVID, that there is also an attention created for flu, but that's something we still have to investigate. Again, I want to repeat, we only have data until 2022. The most important conclusion that we draw out of this study is that there is a growing age gap, so that older people are more confident than younger people. And you could say for flu it's okay because we are now targeting the 65 or the 60 plus or the 59 plus. But if you are then thinking on the people with comorbidities or even the healthcare providers or the pregnancy, they are in this group of the people on younger age and with less confidence in vaccines in general, but in flu more particularly. And this brings me to the pregnant women. Because we did very recently, a study in 10 European countries to find out what the confidence is of pregnant women in vaccines and then including flu. And we see that the confidence of pregnant women is almost 3 times lower than of the normal population. So pregnant women, of which are a target group for the flu vaccines, they are less confident in general. And the fact that we also ask them what could make your decision, or what could improve what could change your decision, or who is changing your decision, the most influencing factors is in fact the recommendation by the healthcare workers. And that's something that is already repeated again and again and again. So what we did also in this confidence study is to look at the confidence of the healthcare provider themselves. And in general, in Europe, healthcare providers are rather confident in vaccines. But if you then ask them if they would recommend the vaccines, suddenly you see a big gap between the confidence and the recommendation of the vaccines. So healthcare providers themselves, they are not always willing to recommend the vaccine. So that brought us to another study that we tried to find out why healthcare providers would not be confident to recommend vaccines. And we asked the healthcare providers if they could answer questions that people or patients ask them about vaccines. And this was really and I already repeat it again and again because I say it in every talk that I give. Only 1 on 3 healthcare providers are confident in answering questions of patients. So only 1 on 3, it means that 2 on 3, they are not feel confident. They even don't want to speak about vaccination with their patients. So then, as a university, we were thinking, yes, but how comes this? Is there something in the education? And yes, there is something in the education because only 10% of the healthcare providers say that they could rely on their education to answer these questions. But luckily, they are willing to follow training. The other experiment or the other survey that we did was among 3,500 students in paramedical and medical. And there we also saw, and then especially for flu, something very particular, that only 42% of the students would recommend, when they are in practice, would recommend a flu vaccine to the general population. So we have really a big issue in education of healthcare providers because most of the general population, they see the healthcare providers as their most trustful source. So it's really focusing on healthcare providers what can really improve the vaccination rate. It's one of the possible solutions, and I think it's one of the low-hanging fruits because it's not that difficult to go and really teach students, paramedical and medical students, on the effect of the vaccine and the reason why you should vaccinate, and that, or give them tools, like I already mentioned, tools that they can find out the answer they don't know, that they can find out in an electronic database or something else, that they can really consultate to give the answers to their patients. So.
Thank you so much for your contribution. And as you say, some mixed messages there in that it's positive that people are looking for recommendation from healthcare professionals, but then not all the healthcare professionals are willing to give that recommendation. Adriano Friganovic, who represents as president of ESNO, representing specialist nurses in Europe, how does that resonate with you to hear that actually you are the people, the trusted healthcare professionals who can deliver this message, but are you doing enough? Is there enough confidence in your own workforce to do this?
Well, first of all, thank you, Sue, for wonderful moderating, because it's important for every panel. It's important to have a moderating, but one bigger And I'm happy to be here and thank Dr. Kulja to hosting this panel discussion and this flu day event, because we are, from this place, we are sending very important message to the public. And we as organization doing a lot in the field of the vaccination, trying to do publications, research, webinars, planning to have a podcasts, storytelling, which is important. We today witnessed how it is important to see examples of people who suffered from the non-vaccination. And we also heard today what was the lifespan before and what is the lifespan today. And we know that vaccine works. And vaccination is our legacy. And we have to protect it, we have to defend it, and we have to empower it. And I think the only thing we should do is to work on the education and information of the general public. And if we are talking about the non-communicable diseases and the people with the chronic diseases, we know that vaccine, that they should be vaccinated. But we also know from the data that there is a variation between countries from 38% in France up to 77, 78% in the Netherlands. And we have to work on that to increase it. And I think it's not enough to work only with the people who had chronic disease or who is over 65. We have to start in the beginning, in the kindergartens, in the general schools, and we have to work. We as a nurse, we are 50 to 60% of all healthcare workers in every healthcare system. And I think it's important to European Union to empower and to give importance to the public health sector and to give importance to nurses who will educate kids, youngsters. And this is also a great example how to approach to them, sending short message using the TikToks. And during this discussion, I remember the cartoon called Life, how our body function. And that's how we can approach to the kids and learn them that vaccine is very important thing, and we had to work on it to increase it, not decreasing.
Thank you very much indeed, Adrian. So you touched there on some of the chronic diseases, and if we think particularly of cardiovascular conditions, what are the extra risks? What's the impact of flu and the greater need for vaccination? Birgit Berger, from the CEO of the European Heart Network, over to you.
Thank you very much for the invitation to an important day. The European Heart Network is a European umbrella organization bringing together heart foundations and patient association in cardiovascular health, as we say. And for us, it is the vaccination and the flu, the infectious diseases have a very strong impact on cardiovascular patients, because the inflammatory effect of the flu virus that can have an aggravation, can lead to a myocardial inflammation, so the inflammation of the heart muscle, but also to stroke. So it means that patients with preconditions, any kind of risk factors, maybe hypertension, maybe obesity, diabetes, who have maybe also these underlying heart conditions are very much touched by any kind of infection which comes on top of it, which weakens the immune system, which weakens the organ system, and in particular the heart to take a central role in the body. And we have seen it with RSV. If it comes to such a link between the virus, maybe a secondary infection, and then it has an impact of the organs, and the heart being a very being very weak and fragile, putting people in a very fragile spot, which could also be seen with the COVID. It was also an infection, and that hit in particular cardiovascular patients. Also patients which didn't have COVID before, they came out with worse health outcome, or with also with cardiovascular conditions. They didn't have cardiovascular before, but after the infection, they with COVID, they had a cardiovascular condition. So from our point of view, it is very important to watch the bridges between infectious diseases and non-communicable diseases, CVD, because you can't just split the body into disease areas. They are interlinked, and with the European Chronic Disease Alliance, I think Brian Ward from the European Respiratory Society here, we thought actually that the ECDC, the European Center of Disease Control, should not only work on infectious diseases, but should also merge these registries. We are talking about data, so that there is data led together which help us to analyze, predict better in the future what we are facing, how big the onset is of a pandemic, maybe, or what we are risking. Because what we've seen with cardiovascular disease, already experts say from the OECD that the numbers of CVD infections are going up in the year 2023 and 2024 because we could not treat CVD patients during COVID. So there are many there are physical aspects of infectious diseases, but also effects on the healthcare systems, which run then down to non-communicable diseases. So it's very important to take these measures we have as preventive measures we have, which are reliable, which are accessible, but we need to use it. And it's sometimes a bit of a hypocrisy of us Europeans. We have the vaccinations, we have them there, but in other countries of the world, they're not exported. And we have the issue that we are vaccinated, we are healthy, we don't have measles anymore. So, for example, there are certain vaccinations which are going down, measles vaccinations, and we as Europeans, when we are traveling, spreading diseases in areas which have not been infected because we are not vaccinating against some of the diseases which we could. So there is a bit of a European hypocrisy that we are not having a conduct which is desirable in that sense, that we are not contributing to global health in that sense.
Thank you very much to Birgit for that contribution. We're going to throw this open to the floor in a minute. I just want to put a couple of quick points. Just quickly, Birgit, on that. Do you think then that cardiovascular patients are aware enough? Because I was really struck by that statistic, and somebody sent these wonderful infographics about cardiovascular patients being 6 times more likely to have a heart attack if they've got flu and they've not been vaccinated. So is there enough awareness among cardiovascular patients about the extra risk?
I think there could be more awareness. Definitely, there is some awareness because if you are in a healthcare system and you are treated as a cardiovascular patient, your cardiologist or your GP warns you, if you go to a dentist, be sure you take antibiotics so you're not risking an infectious disease on top of your cardiovascular condition already. So I think there is a conscious there, but only to those patients who are well integrated in the healthcare system. So it is really important for nobody to be left out of the healthcare system, to have access to the information, to be part of it, and to have these recommendations and the advice of the physician to say, be careful, you are carrying a big risk as a cardiovascular patient. You need to avoid infectious diseases, flu, or even going to the dentist and having an inflammation after intervention. So that it's you need to be and that needs to be carried on. Our organizations, our members at national level, they work towards that, to this awareness raising and empowering patients to understand how to navigate a healthcare system in their favor. But it's work. It needs to be done. We need to interact with social media. There need to be campaigns. They need to reach out, maybe also to communities which are not easy to reach by digital or not by digital. So there's a lot of work to be done. But I think it's very important, and we are working on that.
Thank you. And I think George wanted to add something with another of your hats on, not only in influenza, but European cardiology statistics. Briefly, you've got some data on
Yes.
that.
Last August, the European Society of Cardiology had its annual meeting in London, and I chaired one of the sessions. And during that session, we had how if you have 13 people who have had a heart attack, it's enough to vaccinate them to prevent one more heart attack happening. Now, where does the European Society of Cardiology put influenza vaccination? At the same par as statins, as antihypertensive therapy, as cessation of smoking, at the same level. So important for the cardiovascular patient to get vaccinated.
Thank you. Let's take some questions from the room. I expect you're all bursting to speak. Would you say, please, who you are?
I'm Bruno Lina. I'm a virologist. I'm coming from France. I'm responsible for the French National Reference Center. We have been, and I'm the chair of a group that is called the Global Influenza Initiative. And actually, we've been talking with STOR a lot of time regarding the prevention of cardiovascular disease and stroke through vaccination. And one of the big issues was that cardiologists are aware, but sometimes they feel like it's not their role to vaccinate, which is the GP which is supposed to do it. So at the end of the day, sometimes some of the patients are identified as being eligible for vaccination, but they don't receive the flu vaccine because actually the doctor that is supposed to do it, or the nurse or whatever, is not doing it. Because nobody's doing it, everybody thinks the other one has done it.
Yes.
So I think there's a need for a strong message saying that cardiologists can vaccinate.
Okay. Anyone want to pick that up? Adriano, you're being accused of not picking this up here.
No, I'm not. Well, doctors prescribing, nurses providing, but it's. I think Mr. is right because always someone else thinks it's his duty. And if cardiologist said, for your good sake, you should have a vaccine and we can do it today, will it take? I think that 95% of the people will take it, but it's up to how we sending a message to the patient. And if we are getting to the others, to the GP, or we're lost in translation. It's not strong message that it is important.
Yeah, I think maybe just to add on, the healthcare system could sometimes be more easy to access. Is, for example, if I want to get my flu vaccine, I first have to go to the pharmacy, buy the vaccine, bring it to the GP, keep it in the fridge, bring it, make an appointment with the GP, and have it then vaccinated. And that's a bit of a long-winded way. And it's already almost end of October. High time for the vaccination, but I haven't been to the pharmacy yet. I said, okay, next day I'm working from home. I'll get to the pharmacy. But sometimes the healthcare systems, the pathways could be better aligned to make it more easy to have it.
Thank you. Clara, I think you wanted to say something.
Yeah, there could also be a digital solution that you have also the main diagnosis included in the vaccination record, so that you could actually prompt or send reminders to those who have certain diagnoses. That is also a way of. We're working on that.
That's very helpful.
Or you can also turn it upside down, that you add it to the medical record of the patient, that when some doctor or healthcare provider opens the medical record, that he sees that the patient is vaccinated or not, that he can recommend the vaccination, so that you see it on the medical record of the patient itself.
Good point. Thank you. I think a lady over here would like to say something.
I wanted to make a comment on a question to people I come from the organization, and I work a lot on HPV policy, so related to vaccination, of course, and also personally involved in vaccination initiatives. So I see a lot of common points related to general vaccination policies, and I was particularly struck by the comments from Greet about the relationship between healthcare professionals and the population. But I want to stress again maybe the point about young people. I'm part of the WHO Youth for Health Network, which is a network of young people talking about these issues and really how much is important that young people are involved in the conversation in various ways. There are some countries that are not super digitalized, but I'm imagining that there will be in the future. But indeed, I was thinking that for the point of view of all these ingredients that should be together to make a successful vaccination campaign and high coverage, I think we also need some more political will, probably, especially from member states. And I wanted to ask you also, what do you think now? Because I'm not sure what's the country with the lowest vaccination coverage. We talked about the highest vaccination coverage, but if you know which is the country, what are the countries, what are the problems there, and how we can help them indeed achieving having a better success, because indeed it's a question of member states, and the European Union can help.
Andres, would you like to take up that point?
I know Lithuania has the lowest vaccination rate, is 7.7%, and also Bulgaria has some 8.9%, and it's very low, because 15 years ago the goal was to reach the 75% across Europe, and it's just scary how low numbers we see in some countries, and it's also important topic. So we must analyze the situation there to see what are the main concerns of questions to people that because of them they choose not to get a vaccine, and also, for example, I think it's very important in our communication, especially when we try to talk with the younger generation, to highlight the logic behind and the mechanism, how, for example, influenza can cause a heart attack, because not the virus causes a heart attack, but when you got the virus, you have a fever. A fever increases the cardiac output, so the heart consumes more oxygen, but with a sclerotic coronaries, the heart cannot get enough oxygen, and there is a heart there is a high chance it could cause a heart attack, also because of the higher flow rate in the coronaries. And through social media, I created a video about HPV, and it reached about 1.2 million views, and out of 1.2 million, 1 million was individual views, 10% of Hungarian population. But before that, I created many videos. So again, trust, and I think the low vaccination rate is a sign of lack of trust in our healthcare system or healthcare providers. So I'm not sure that is the only reason, but it's a big part of this problem. And with the AI solutions and with maybe the European health database also can help us, because we could see data and analyze and find those parts and those communities or villages or points where there is the lowest vaccination rate, and talking to them, ask the people there why they made this decision. With those questions and answers, we can maybe find a solution.
Thank you.
Very difficult, and I think the highest rate is actually in Denmark, about 74%.
Yes. So there's some great ideas being suggested here about how digitalization, data tools can help, how the focus on the non-communicable diseases like cardiovascular is really important to get those vaccination rates up. I'd like to ask each of our speakers, as a sort of closing thought, very, very briefly, how they think one thing that might actually help push towards that 75% target that was set. And Wolfgang, perhaps start with you because it was touched on about political will. Very briefly, a couple of words. What key thing would you like to see happen to make that push forwards?
I think it was already mentioned, a fast implementation of the European health data space. That is something to provide data, but then nevertheless, somebody needs to work professionally on how to use these data and use them to pursue the goal, like, for example, reaching out to younger people or reaching out to older people and passing the information that's needed to pick up a vaccination.
Thank you. George, a couple of words. What one thing would you like to see happen?
Extend the vaccinator to the nurses and the pharmacists. There is at least one country in the EU that only the doctors can vaccinate. That is not on. The nurses are the main vaccinators, and also the pharmacists can do a wonderful job. Last influenza season in the UK, they administered 3.8 million doses to NHS eligible patients for influenza vaccination.
Fantastic. Tyra, what's your one thing?
Yeah, vaccination registers and easy access. So also access outside normal working hours and in weekends. I think that would also help.
That's great. Great.
You can predict it's the training and especially the inclusion of a vaccine course into the curricula of the medical and paramedical students. And on top of that, I think there would be it would be nice to have a general system on adult immunization, not only thinking on flu, but all other vaccinations that can come. That there is a structure like you have in most countries on children vaccination. There is also a clear structure for all the people where to go for their vaccines.
Thank you. Birgit, basking in the autumn sunshine there. What's your one thing?
Well, one thing, we are with the cardiovascular community, we are looking forward to a European cardiovascular health plan. And as a part of this cardiovascular health plan, we would like to see a seamless patient pathway through from primary to secondary, tertiary prevention and rehabilitation, and facilitated by digital. And I think the issue of vaccination as being such a critical, flu being such a critical risk factor in cardiovascular disease, that should be part of this cardiovascular health plan. So that would be my thing where I'd like to see it integrated and thus part of the healthcare system, so we don't miss out on the cardiovascular patients in another infectious situation.
Lovely. Adriano, in a few words.
Well, as I said before, I think essence is in education. I think we should need to find the right content, right channel, how to approach the population. A few weeks ago, I heard one of the unsuccessful campaign, and I said, well, there's no unsuccessful campaign if we change one attitude. We're healthcare workers. We need to do and dedicate our work to changing the attitudes and giving right information to the people, how they will keep their life healthier and safer.
Thank you. And I think that Anais and Davy made their very powerful message earlier, saying that vaccination is for all, and that was such an important message. There's a short message I'd like to send to you from MEP Dolores Montserrat, who had hoped to be with us today, but urgent business took her elsewhere. And she is on the steering group of influenza vaccination and wanted to thank everybody for taking part at this very important event today, reiterating how very important it is that vaccination is taken seriously, that the EU's target of 75%, particularly for the at-risk groups. She says it's more relevant than ever before to expand it to the other respiratory viruses like COVID-19 and RSV. She particularly highlights cardiovascular disease, and she talks about the healthcare professionals having a very important role in advocating for their patients. She touches on the harmonization of data and digitalisation so that publishing data in a timely way can be used to the full potential. And she says that progress can be made. All we need are the right policies and the political will to put them into place. And she reiterates the steering groups calling on the next council presidencies to take up this message, proposing an update to the 2009 guidelines on seasonal flu vaccination, extending this to cover other respiratory viruses, COVID and RSV. We've heard fantastic testimony today. Davi, you would like to have a little word for us, a final word, please.
En France, on recommande la vaccination aux personnes âgées, aux personnes fragiles. Qui est-ce qui peut dire qui est fragile ici ou fort face à un virus? Personne. Personne ne peut savoir. Le fait de recommander quelque chose de cette manière, dire que l'on est vieux et puis que l'on est faible, c'est faux. Cela contribue à la désinformation. Après avoir partagé mon témoignage sur Internet, il y a des gens qui m'ont fait des retours positifs. Évidemment, il y a des gens qui m'ont fait des retours négatifs, complètement désinformés. Mais désinformés par la politique. Parce qu'on dit que ça concerne les personnes âgées. Parce qu'on dit que ça concerne les personnes jeunes. C'est faux.
Thank you. Laura, will you kindly give us a little translation?
So
Thank
in
you.
France, it is recommended that people get vaccinated. Which people? People who are elderly or who are fragile. But he was asking who here thinks they are strong against viruses. Everybody is fragile. So when we recommend vaccines to people who are elderly or who are weak, this is also misinformation. When he shared his story on the internet, he got positive feedback, but also negative feedback. Negative because also of misinformation, because of the politics that also keep on saying that we need to vaccinate only elderly people or entirely elderly people and fragile.
Thank you. And thank you to our host, Dr. Andras Kulia.
Thank you.
Thank you very much. We may not all be on TikTok, but you can perhaps use the hashtag EU Flu Day to tell the world about the important discussions that we've all had here today. A huge thank you to all our speakers, to everybody who's participated in putting this together, and I think especially to Anaïs and to Davi. Thank you all very much.
Just to most of the sorry for that. One thing I would like to correct myself because I said Lithuania, but actually Lithuania is about 10, I don't want to say but thank you very much for being here. It's just very important. So big thank you today and nice to share your story. I think it's super important. Because that's how we can show people how important this topic is. And I also want to thank you, Valentina, and also to my assistant, Danai, for helping to organizing this event. And thank you again.
Thank you.
Thank you.
Thank you.